Has dementia gotten you down? Has a family member who you love, who you know, is suffering from dementia? Are they? Does it seem like it's Alzheimer's coming on? Have they forgotten, just losing control of how to think and express themselves and remember things? Or are they getting lost and you have to look for them? Dementia is a debilitating condition, and there are thousands upon thousands of people who suffer from dementia, and there really is no medication out there that's going to get better brain function. We've got to look in the brain tissues, we've got to look in the blood vessels and the organs and find what's really going on with the individual. And what's even more important is that the laboratories that you may be going for a regular red blood cell test, unless they're anemic, and that is part of the answer, possibly, but red blood cells, white blood cells, liver enzymes, kidney function, blood sugar levels, cholesterol levels, you're probably not going to find the answers in those tests. An MRI of the brain, unless it shows that there's some type of lesion in the brain, they're probably not going to find what's going on in those tests. Going to a neurologist for a neurological examination, looking into the eyes with a light, or listening to the heart, or checking knee-jerk reflexes, probably not going to find why dementia is going on, why somebody you love is suffering. My name is Dr. Lonnie Herman, and I'm going to share with you in this examination some very unique exam findings of a woman who's 73 years old. They came to my clinic in South Florida, she and her husband, from California, and this woman has lost her ability to speak, and she is not controlling her bladder well. She's not saying a word. She can look at you and smile, and she looks very pleasant, but there is no speech. And she went from normal function with her husband for many, many, many years to now he's got to watch after her because the bladder has lost control, as I just said a moment ago, and she's just not all there. And again, it's not just the speech, but she's just not all there. Well, my understanding about the human brain and the body for any disease process is that there are triggers for these different types of degenerative conditions that can develop in the body. The breakdown of the brain function. These can come from infections and toxins and electromagnetic stressors. Always, 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 what is left hidden, what is often misunderstood, or maybe even sometimes disagreed upon in the general medical communities, is that there are infections. They may not believe this, but there are infections that can get up into your brain. There are toxins that can get into the brain, and they can derange the brain function, cause malfunction up there. So before I even get into this, you may want to share this video with one friend, really pass this along, because the information I'm going to share with you here, if you or someone you know or love is suffering from dementia or early Alzheimer's, you and that person and the family deserve to hear something different and something that just makes sense. And so passing this along can really help some of your family members or friends get a grip on what the possibilities are here. In my very unique type of work in my clinic in South Florida, I'm able to actually, I'm able to listen to a tissue in the brain or a blood vessel in the brain and find out what's going on in there. And no, this is not regular medical work, and there is work that was developed in Germany and Russia for over 50 years. There's biophysicists who are involved and quantum physicists involved, and some brilliant people who have been able to determine that there is a way that we can actually listen to the tissue and find out if the tissue is stressed, and not only if it's stressed, how bad the stress is in that tissue, but also what kind of infection and or infections are in that tissue causing it to not function the way it's supposed to, what kind of toxin can be in that tissue causing it not to be able to function the way it's supposed to, what kind of electromagnetic stress, like a cell phone, can be causing deranged function of that tissue. And as well, we can actually make remedies that can precisely target and remove, eliminate safely these toxins and these infections and these electromagnetic stressors from the tissues. So sit back and listen to this video as I share with you the exam findings of this very nice but this woman who's suffering from dementia and an inability to speak. And they've been around to many different physicians, as was reported to me by the husband. So the first tissue, the weakest link in her body, turned out to be her cerebral arteries. These are arteries that go into the whole brain. They bring blood flow that carries oxygen to your brain. Even sugars go up to the brain because the two fuels for your brain are oxygen and sugar. So we've got to make sure that the blood supply up there is perfect, that it's clean, and it's oxygen rich. Wouldn't you agree? I hope you do. Well, in the first part of the examination here, what I found in her cerebral arteries, parasitic flukes, damaging, stressing, inflaming her cerebral arteries, anesthesia chemicals. You know, her husband, you don't know, excuse me, let me just say that, sorry for that term, but her husband had mentioned to me during the consultation that he noticed right after she had some procedure done, there was surgery where she was put under an anesthesia chemical, that she started to have a mental decline shortly after that. Well, I found in her cerebral arteries, through this method that I practice, this bioresonance, specific and precise and accurate method, bioresonance method, manual, no electrical equipment that I use, I found anesthesia chemicals in addition to the parasitic flukes in her cerebral artery. I found she has antibiotic residues like Cipro, a dangerous antibiotic, damaging her cerebral arteries. I found the contrast material for the MRI. She's had an MRI dye before. Well, they study the brain or study another part of the body where they put the dye in, and they could trace that dye going through the blood vessels. I found MRI contrast material dye, MRI dye, in her cerebral arteries. I found a very high level of streptococcal B infection, strep infection, like a strep throat. You could swallow that strep. Maybe the strep was in a tooth. She has a lot of dental work that was done in her mouth, a lot of poisonous mercury fillings in her mouth that they can't remove yet because she won't follow any commands. You can't just tell her. You could tell her, but she won't listen and follow. Keep your mouth open. She won't keep her mouth open. She might open the mouth and then close it, and she just doesn't listen. It's definitely a difficult experience to watch, that somebody can actually lose some cognitive function here. So strep infection could have been in a tooth or been in the tonsils, been in the throat, and it can go up the carotid artery right up into the blood vessels in the brain. Well, the strep infection was also in the cerebral arteries in this exam. She had Candida albicans, which is a yeast-like fungus in those cerebral arteries. That's inflaming the brain. That is causing loss of oxygen flow to brain. Not enough to make her die right now, but there is causing degeneration of brain function. I found Candida glabrata in addition to the Candida albicans, Candida glabrata and Candida krusei, two other yeast-like fungal infections in those cerebral arteries. She also has in the cerebral artery, at least she had on the day of the exam, chlorine, Clorox bleach detergent fumes, which we have breathed in when you go into a bathroom that was just cleaned with bleach, or maybe you went in a swimming pool and it went in through the skin, the chlorine, which is the same thing as a Clorox type. I'm not naming out that brand, but any chlorine detergent is what I found as a chlorine detergent in the cerebral arteries that we are removing with precision, safe and effective remedies, like cures like. We can get an exact match in a remedy, the frequency and the potency of that toxin, and get it out of that brain tissue, get it out of this, in this case, cerebral artery. House dust particles, and the fourth type of candida called Candida tropicalis, Candida tropicalis in her cerebral arteries. I also found organochloride pesticide chemicals in those cerebral arteries, damaging the cerebral arteries and causing less than normal oxygen and blood flow up to the brain tissue. That can't be good. That is not good for the human brain function. Now, if you and or a loved one suffers dementia, are your doctors telling you anything like this? Are they running any kind of exam where they say, we know that we found that infection in that blood vessel? Are they doing anything like that? I don't think so, at least not from the people who I've spoken with. In my experience, they're not telling me that they've ever had a doctor do this kind of exam and find what we're finding, what I'm finding. There's another blood vessel. So the cerebral arteries that bring blood up into the brain, we also have these blood vessels called carotid arteries, and these carotid arteries on the right, or excuse me, your right and left side of your neck, they go up to and connect to an artery that looks like a circular shape. Like an off, it's not perfect circle, but it is in a connected type of oblong, circular shape, if you will. So those carotid arteries, they connect to this circular artery that we call the circle of Willis. The circle of Willis is the circular artery that the brain and brainstem just plugs, it just sits right under. And that circle of Willis has arteries that go right into the brain that we call the cerebral arteries. They branch off of that circle of Willis. Well, there was an amazing, astonishing, huge amount of the same anesthesia chemical in her circle of Willis artery that was also in the cerebral arteries. I also found chlorine detergent bleach in her circle of Willis. In the carotid arteries, there was also the anesthesia substances, damaging, decreasing the ability of those carotid arteries to function appropriately. She also had heavy bacterial infection in her carotid arteries. We're actually going in with samples of white blood cells remedies to go into that carotid artery and clean itself out of the infection. I found that the veins, which drain, veins are very important in the brain and the whole body for that matter, but veins drain away. See, arteries bring blood to the brain and the veins take the blood away. So we bring oxygen up to the brain, and then there's a conversion where the oxygen is gone and the carbon dioxide has to leave through the vein. So when the carbon dioxide leaves, what happens when the vein is a bit congested? When it's not working as good as it should, and we have kind of a sludgy, we don't have a nice smooth flushing, let me put it that way, of the used blood and the toxins and infections that we're trying to get rid of from the brain. So let's say that there's a slower detoxification through the veins of the brain. So we're going to get a backup, and lactic acid can build up in the brain. We can actually have less than normal oxygen in the brain, and we're having deranged brain function or degeneration of the brain develop. So I found in her veins that there was infection as well as that chlorine detergent. The kidneys, which filter the blood, there was also anesthesia chemicals in the kidneys. The pelvis renalis, here's your kidney, and you have a funnel that comes out of the kidney that turns into what's called your ureter. Well, the pelvis renalis, I found calcifications in that pelvis renalis, which we'll get rid of with remedies. I also found in the motor neuron, your motor neuron, for those of you who are watching this who don't know too much about the anatomy and physiology of the human body, in your spinal cord tissue you have these cells called motor neurons. These are nerve cells that receive information from the brain and they project the information out to the thyroid or out to the stomach or out to the heart or out to the intestines or out to the liver. These motor neurons, they tell the organs how to work. They tell our body parts how to function. It's not just we need a bladder, if somebody's losing their bladder control, they have incontinence, maybe there is a problem in the bladder, maybe there is infection at that bladder, maybe there is something wrong with the sphincter in the bladder that stops the urine from coming out, but maybe there's a problem right at the motor neuron, the nerve cell that tells that sphincter how to work. Maybe the nerve cell that sends the signal to the bladder is not doing okay. So this woman does suffer incontinence. She can't control her bladder function. And I found a very high level of anesthesia chemicals damaging and stressing her motor neuron cells, which will then, wherever that goes, if it's to the bladder, if it's to the heart, if it's to the stomach, the intestines, it's going to cause deranged function of those cells, those tissues, those organs. I also found that she had anesthesia chemicals and the chlorine in her aorta. I also found Candida tropicalis and in her aorta, a very high level of bacteria and intracellular parasites in the aorta. If you don't know what your aorta is, it is the main blood vessel that comes off the heart that brings blood up to the carotids, up to your vertebral arteries, also down to all the organs, and the whole spinal cord gets fed by arteries that branch off of your aorta. Your aorta feeds blood to your kidneys, your stomach, your spleen, your pancreas, your thyroid. Everything has to branch off of that aorta. Okay? Thyroid actually comes off of the carotid artery, but I won't get too technical here, but the carotid comes off of your aorta, so everything comes off of the aorta. So she had a very high level of Candida tropicalis and bacteria and parasites in that aorta. I also found that she had bleach, the same chlorine type of bleach in residues in her vertebral arteries that bring blood up to the back half of the brain or back quarter of the brain. And also in the basilar artery, your vertebral arteries in your back of your neck, they come together like an upside down V. So carotids are in the front, carotid arteries in the front, vertebral arteries are in the neck, spine, the bones, the vertebrae, your spinal column. These vertebral arteries go up the neck and they form an upside down V, like this. Well, at the top of that V, there's a little artery that's a straight tube. It's probably about that long. It sits right on your brain stem. The basilar artery is in the back, comes off the back of the neck from the vertebral arteries that form an upside down V. The basilar goes to the brain stem. The basilar artery was loaded with bacterial infection, and we're using a very high level, a potent dose of white blood cell remedies along with the basilar artery remedy to clean up that basilar artery, because we need better blood flow to get to these tissues, because without the brainstem working efficiently and the way it's supposed to, serotonin can't be made, dopamine can't be made, acetylcholine memory can't be made efficiently. That can cause deranged brain function. That can cause bladder malfunction. That can cause a number of things. So in this protocol, we're cleaning up the cerebral arteries, we're cleaning up her circle of Willis artery, we're cleaning up the carotid arteries, the veins, the kidneys, the aorta, the motor neuron, the basilar artery. We want to make sure that all these blood vessels are clean and clear, and allowing the brain to get its clean, oxygen-rich blood supply, and to make sure that the brain is able to dump out toxic waste. Because when it can't get their oxygen-rich blood supply and it can't dump out the toxic waste, what do you think is going to happen? Do you agree, after you're hearing this, that deranged brain function can occur? It makes only sense to me. So this protocol this woman is on will last for almost 2 months to help her clear out these problems from the brain. And I do look forward to seeing her again and monitoring what progress she can experience with this work. And after that, I will produce another video and help share that with you. But even this should be enough. This video should be enough for you to realize that there is other work available, that there is other information available that you're generally not hearing from the drug companies and from your common doctor who you're seeking care from, and or a drug company that you can just take a pill from. So, or the commercials on television, or the nightly news, or the morning news, or your afternoon news. You're not going to hear this information because they don't produce this kind of stuff. They don't do this type of work. You can find me, again, my name is Dr. Lonnie Herman. You can find me in my clinic in South Florida. You can find me on my Facebook page. Do like my Facebook page, because I always share very useful and unique information, a very unique understanding about what goes on with chronic disease and neurodegenerative disease, as well as cancers and other conditions and autoimmune diseases as well. So like me on my Facebook page. Subscribe on my YouTube channel. I put up videos very often, and you deserve to watch these videos and learn more and understand more and come to grips with that there are other methods out there, that you don't have to feel like you've lost the battle in this life. And so subscribe on my YouTube channel. Share this video with one friend. That's very important, because there are other people who deserve to know this information as well. And you can call to set up your consultation appointment and your first examination by calling 954-370-3100. That's 954-370-3100. And when you call, speak to my assistant. She's very happy to help you, but she doesn't have all the detailed information of what we're really going to go over. What you need to know about a consultation, which I do charge for. Insurance does not cover this kind of work. They don't approve of this. They don't realize it. They don't accept it. Is that the consultation, we've got to dig into your history to find out what could cause your condition. That gives me a better chance of finding out what is going on in your brain and your blood vessels in your body that's causing this brain breakdown in brain function. The first examination is going to be very unique. We've got to be able to dig into these tissues without taking biopsies, but it's going to give us a similar presentation like a biopsy, because we're going to be able to find what kind of infections and toxins are in your tissues. And you will go home with a protocol that, whether it lasts a month, 3 weeks, 6 weeks, 8 weeks, whatever it is, you're going to be able to start to turn your life around, because your brain cannot function well when there's infection and toxin robbing your brain's ability of normal brain function. It is not possible. when we clean up these brain tissues and clean out these blood vessels, it is possible to have normal brain function.